Over the past 25 years, obesity rates in the U.S. have more than doubled. We can curb this trend by helping kids develop the kinds of habits that will help them stay at a healthy weight. Because kids who develop healthy habits, such as getting plenty of exercise and eating healthy foods, are more likely to continue these habits into adulthood. HELM stands for Healthy Eaters, Lifelong Movers. It is a project of the Rocky Mountain Prevention Research Center at the Colorado School of Public Health and funded through a grant from the Colorado Health Foundation. HELM is the umbrella project for two separate but complementary programs, the Physical Education Academy and AIM. Both of these programs started working in the San Luis Valley in 2011 and expanded to the southeast region of Colorado in 2014. In addition to helping schools become healthier places, HELM is a research project that collects data on the effectiveness of its programs, with the hope that they will continue to grow and be able to help more students at even more schools. The Physical Education Academy works with PE teachers to deliver high-quality PE using an evidence-based curriculum called SPARK. Teachers receive professional development and one-on-one coaching to improve their practice, and schools receive equipment to implement the SPARK curriculum. The other part of HELM, and the one that brings us here today, is called AIM: Assess, Identify, Make It Happen. AIM is a strategic planning process during which school task forces come together to make changes to the school environment, policies, and practices so students eat healthier and get more physical activity during the school day. We learn about best practices as well as gather information about the school and students to make sure we put changes into place that will work. Having a committed task force is essential. Members of the AIM task force share insights, discuss strategies, and take action for students' healthy eating and physical activity. A trained facilitator plans all of the AIM meetings and acts as the tour guide through the AIM process. The task force decides what changes to make and how to best put them in place. We will meet 9 times total, 8 times this school year and once more in the fall to check progress and wrap things up. Meetings are scheduled for 2 hours, and there is a lot packed into each 2-hour period. AIM is broken up into 3 distinct components: assess, identify, and make it happen. By completing each part, we make sure that changes made are relevant to students and the school, that they will have the desired result, and that once in place, they will be around for many years to come. During the first 2 meetings, we will assess the school environment and learn more about what the students need. This helps us know what resources we already have in place and helps us establish our goals for improvement. In Meeting 1, we learn about AIM and start to understand the current state of physical activity and healthy eating at the school by composing a picture of all the great things already happening. By Meeting 2, we're ready to dive into the areas for improvement. In other words, when and why are some students not getting enough physical activity during the day? And when and why might they not be eating healthy foods? When we finish with assess, we're on to identify. This is the time that we think of ways to address the needs. By looking at best practices, we will come up with possible changes to address the needs we see. In Meeting 3, we evaluate the proposed changes based on the impact they will have, as well as how easy or difficult they will be to implement. By Meeting 4, we will be ready to select the 2 healthy eating changes and 2 physical activity changes that we want to implement. Once we have selected the changes that we want to make, it's time to make it happen. In addition to putting the changes in place, we want to make sure that they stick around for many years to come. In Meetings 5 through 7, we will work in planning teams to develop action plans to make sure the changes are successful. Action planning starts with getting approval to make the change and building buy-in among key stakeholders. Without buy-in from those who will be using and implementing the changes, changes can fall flat, but when changes have the backing of the whole community, they thrive. By meeting 6, we are ready to start taking steps to put the changes in place. What information do we need to gather? How will we make sure everyone gets the training they need? Do we need to purchase items or get volunteers on board? This is the time we think about the nuts and bolts about getting the change up and running. Meeting 7 is when we make sure that we have everything in place to keep the change going once AIM is through. Adding changes to existing wellness policies, planning for ongoing trainings, or including information in staff manuals are all ways to ensure the sustainability of changes into the future. Meeting 8 is the final meeting of this school year. This is the time to make sure everything is covered so changes are in place by next fall. Our last meeting as an AIM task force happens at the beginning of next school year. This is meeting 9. During meeting 9, it is time to pass the baton. We will determine how this committee will look once AIM is over. For example, some schools like to continue meeting as a wellness committee to follow up on changes and implement new ideas. Keeping the conversation going is one way to ensure that opportunities for physical activity and healthy eating continue to grow at the school. AIM: assess, identify, make it happen. Your participation will bring more opportunities for students to eat healthy foods and be physically active during the school day. It is truly an investment in their health, their academic success, and their future. Thank you for being part of the AIM story. AIM was created by Dr. Elaine Belansky, who serves as co-director of the HELM project. The AIM project manager is Dr. Ben Ingman. To contact Elaine or Ben or learn more about AIM, visit www.aimschools.net.